Cool. Thanks everyone for coming and joining us. We're excited. Obviously, this is Excel Physical Therapy, and we are just getting back into doing our community education series. We took a little bit of a hiatus because of something that happened kind of 2019, 2020, but we're back at it right now. And a few community events to take note of coming up. Gallatin Valley Avalanche Center is putting on some free field sessions kind of throughout the winter, which is really awesome of them. Mountain Project's having their final community bouldering comp first part of January. The Banff Film Festival, which is a big fundraiser for BSF, is middle of January. And then the Bearskin Skimo series is starting up in January. I am usually the lone split boarder, so if anyone wants to come and split mow with me, feel free to come and join. All right. Brittany. And then BYAP Bingo Fundraiser is a big fundraiser for them in early February. And then a big fundraiser for just Bear Canyon and keeping access for that is late or middle of February too. So we're going to get started here. My name is Jason Lunden. Of course, the clicker doesn't work. And with me is Kylie Metzger. We're both PTs here at Excel, and we're both qualified to talk about this because I've tore my ACL snowboarding many years ago and gone through rehab, and Kylie tore her ACL skiing a year ago. Yeah. And is currently going through rehab. So this is an important topic to talk about because of the high incidence of ACL injuries in skiing and snowboarding, and we truly are hoping to keep you out of here and keep you on the slopes. So I'm going to turn it over to Kylie to get started. Let's see.
Okay. So, like Jason said, we're both super passionate about this subject. I am currently going through rehab. I don't want any of you to go through it. So, talking about preventing ACL injury, stuff we're going to go over today. First off, why? Why is it important to prevent an ACL injury, and why is the ACL important? Next, Jason's going to go over the how ACL injuries occur in both skiing and snowboarding. Action, preventative strategies that you can take to prevent injury to your ACLs. And then lastly, when. When and how can Excel help you? So starting off, what is the ACL? The ACL is the anterior cruciate ligament. You can see this red line depicts where the ACL is. It originates in kind of the anteromedial aspect of the tibia, which is our lower leg bone here, and attaches onto the posterolateral aspect of the femur, big leg bone here. Super important stabilizer of the knee. It's going to resist a lot of the rotational forces and hyperextension during dynamic activities of pivoting, cutting, twisting, all things that are happening during skiing. So super important, you want that intact in your leg. Why is it important to prevent ACL injury? First off, it can be a really expensive recovery. It's shown lifetime costs of ACL reconstruction can be upwards of $40,000. And in general, it just is an interrupter of life. You're gonna miss ski seasons, miss summer sports, and it's just, like I said, gonna get in the way of life. Moving on, another aspect of why it's important to not tear it is it can be a really interrupter, like I said, an interrupter to your ski season, but it can also affect secondary knee injuries and later lead to some degenerative osteoarthritis in the knee. Next, Jason is going to talk about how ACL injuries occur in skiing and snowboarding.
So as Kylie mentioned, the ACL is the most important static stabilizer of the knee. And therefore, if you injure your ACL, it's really hard in most cases to get back to dynamic sports such as skiing and snowboarding without feeling that instability and having it really affect your ability to do those sports. One study by Stedman et al. Showed that 90% of US ski team members sustained a knee injury. And most of that 90% of US ski team members actually sustained multiple knee injuries and requiring surgery. And when you consider that the ACL tear is the most common knee injury to occur in skiing, you're looking at probably pretty close to 90% of US ski team members have torn their ACL, at least based on this study. If we look at skiing versus snowboarding, is overall there's a much lower incidence of ACL tears in snowboarding, with 6% of beginner level snowboarders tearing their ACLs. However, if you look at more elite level or advanced level snowboarders, that rate increases substantially up to 30%, which is on par with the incidence of ACL tears in skiing. So with skiing, again, knee injuries are the #1 injury or body region where injuries occur. And if we look by discipline, alpine skiing, so thinking about racers, so World Cup racing, even recreational racing, the incidence is 28%. Freestyle skiing, just a little bit higher, 30%. So thinking of slopestyle, half pipe, and moguls. And then in recreational skiing, we see that the incidence is 22%. However, if we look at beginner skiers, they actually have twice the rate of ACL injuries than non-beginner skiers. So really taken as a whole, if we have expert level skiers or snowboarders, alpine skiers and freestyle skiers all having about the same incidence, with just a little bit of a lower incidence in beginner skier or recreational skiers, but still a pretty high incidence with beginner level skiers. And if we think about, again, looking at that kind of higher level or competitive level of skier or snowboarder, this is from a study that was just looking at injury rates in the 2010 Olympics. So it's just a single snapshot in time and isn't really representative necessarily of what's happening year in and year out. But if we look at this, snowboard cross by far had the most number of injuries, followed by freestyle aerials and skier cross, and then snowboard half pipe. Parallel giant slalom and snowboarding was pretty low, and just so happened to be in the 2010 Olympics, pretty low incidence of injury too. But again, overall, the incidence of ACL tears is high, particularly in skiing and in expert level snowboarding. So if we think about snowboarding, again, overall being a decreased incidence of injury, but having the same incidence of injury with expert level snowboarders, it really comes down to their injuring themselves when they're landing wrongly off of jumps. So most snowboarders aren't really going to tear their ACL when they're in deep powder or catching an edge or anything like that. It really comes down to landing incorrectly on a jump. So much so that the lead leg of a snowboarder is injured 90% of the time when we're talking about ACL injuries. And that's because that's the leg that they're leading with downhill when they're coming off of a jump. And the mechanism of injury that happens is, again, either landing flat on a jump and having their knee cave in. So that's what we call a valgus position of the knee. Or we can have what's called a boot-induced or quadricep-induced anterior drawer. So as Kylie was mentioning, the ACL functions to stabilize the knee, both from rotary forces, but it also prevents your lower leg from coming forward too much. And so that's why if you've ever talked to someone who's had an ACL tear, it feels like their knee goes out or hyperextends a lot. It's because of that lower leg coming forward too much. And there's the ACL's not checking that motion. And so what can happen in snowboarding off of a jump, if someone comes off the jump, typically landing flat, but lands a little bit in the back seat, the high back of the binding prevents their lower leg from coming back with them. So basically they're causing that anterior motion of the lower leg to go forward. And then they're trying to prevent themselves from falling. And they do a really quick contraction of their quadriceps or their thigh muscles. And that further brings the lower leg forward, causing the ACL tear. For skiing, there's lots of different ways you can tear your ACL. There's no real difference in most studies that you look at in the incidence of ACL tears in men versus women, which is different than a lot of other sports. So if we think of, non-contact injuries being that like no one's tackled you or anything, but like women's soccer probably has the highest incidence of ACL tears of any sport. And you look at kind of most other sports and you see it predominantly affecting women versus men. Well, skiing is an equal opportunity provider, I guess, of injuries. And there also seems to be, with some studies, no difference in skill level. But again, with what I had said earlier is beginner level skiers in a recreational ski group seems to have a little bit of a higher incidence. In terms of the ways that you can injure your ACL or how they're occurring with skiing, is there's really 4 main incidences or mechanisms of injury. For recreational skiers, particularly beginner level skiers, the most common way someone's going to injure their ACL or their knee is a forward twisting fall. So typically they're going to be in that wedge position or snowplow position and then catching one of their tips, which then you have this long lever arm of the ski driving their knee forward and causing this big rotational force while they're falling forward at the same time. So it's a lot of compression and torsion going through the knee, which causes an ACL injury and typically an MCL injury as well, which is the inside of the knee ligament. You can also have a forward twisting fall. It's more of a hyperextension type fall, which will happen typically in deep powder when someone's coming through and then maybe crosses one of their tips and then falls forward with their knees extended, causing an ACL tear too. And this is, again, the majority of the way beginner skiers tear their ACL. We can, much like snowboarding, have an anterior drawer mechanism in freestyle skiing as well. And this typically will happen, again, someone coming off of a jump, landing flat, landing in the back seat, so landing on the tails of their skis, and then momentum drives their tips forward, which then, again, drives the boot forward, which is hitting that lower leg and causing that lower leg to go forward. The skier is trying to prevent from falling, so they do a quick contraction of their quads and cause that further forward motion, causing the injury there. And then in more advanced recreational skiers, the most common mechanism of injury that we see is a backwards twisting fall. So this is where someone catches the tail of their downhill ski, and at the same time they're going down to sit down to kind of try to soften the blow of the fall. And the ski catches and twists while they're leaning back, and then typically one of their arms goes back too. So they get all this torsion going in throughout their body, and with that tail of the ski catching, driving the knee further forward too. And so kind of, one of the reasons we're going over like how this happens is so that you can have a little bit of a better understanding on how we can try to prevent these from a technique perspective when I speak in just a few minutes. And then lastly, there's a slip catch mechanism that can occur. This is how the vast majority of alpine ski racers end up injuring their knee. So this is when they're driving through a turn, they lose contact on their outside edge. They go to extend their knee to regain contact, and they basically catch the inside edge of their ski, again, causing that big torsional moment to the knee. And oftentimes they don't actually end up falling all the way down, but it's enough force to cause that ACL tear, and then they are able to ski out of it, so to speak. But again, it's from losing contact on the downhill ski and then catching the inside edge of that is how that's occurring. So really, how can we mitigate the risk? So we can't really necessarily prevent ACL injuries from occurring altogether, but we can really try to do some things to decrease the risk of ACL injury or just any injury in skiing. First and foremost, especially in skiing, is checking your equipment. Okay, there's been a lot of studies looking at, how can we mitigate risk of ACL injury in skiing, and a lot of attention paid to equipment. So one of the big things is really failure of release of the binding, particularly in that backwards twisting fall. And so making sure that you're getting your bindings checked for the DIN setting and making sure that the mechanisms are working properly on almost an annual basis. Because a lot of the studies show that those people who end up injuring their knees have a much older date of last adjustment of their bindings. And along with that, there seems to be an increased risk with women when it comes to equipment with looking at the bindings, because a lot of the ISO settings for determining DIN don't necessarily take into account the differences between strength to weight ratios in men versus women. So they're usually, those DIN settings are more set up for men, which might be too high of a DIN setting for a female skier. And then also when we're talking about bindings is the standing height ratio is something that seems to be a factor as well. And this is really talking to the difference between the height of the toe of the boot to the heel of the boot in the binding. And those skiers that had less of a difference, meaning that their foot was more flat and their heel was down closer to their toe, had more of an incidence of injury to the ACL than those skiers who had a little bit more of a standing height ratio, meaning that they're up on their toes a little bit more. Other things to consider are ski length, particularly in beginner skiers, and having beginner skiers use shorter skis, so there's less of that lever arm for when or if they catch their tips. And then last thing to consider in skiing is the sole wear on the bottom of your ski boot. If the sole is really worn down, it's not going to engage with the binding as well. And so therefore the binding may fail to release as well too. There's a study by Rudel et al. Really showed that those skiers who had either excessive toe or heel wear on their boots were more likely to tear their ACL. For snowboarding, just make sure your bindings are tight is the biggest thing, and maybe playing around with the angles, but there's not too much in terms of, from an equipment standpoint, for mitigating risk of ACL tears in snowboarding. Okay, check your equipment at the beginning of the season, preseason, before it starts. What can you do when you're actually getting to the hill or getting to the mountain? A dynamic warm-up is one way to really kind of help mitigate any injury risk by going into the sport in more of a warmed up position, making sure that your joints have gone through all the ranges of motion that you're going to need to go through in your sport, whether it be skiing or snowboarding. And this will also help with performance as well. So there was a study out of Australia looking at the effectiveness of a dynamic warm-up on performance and just overall muscle warmth with that. And as little as a 15-minute dynamic warm-up prior to getting on the chair can have effects up to 30 minutes into your ski day. So it can be a great way to get after it a little bit sooner rather than just trying to warm up by taking some easy runs. And it showed that dynamic warm-up too resulted in better flexibility and better, again, overall kind of warmth of the muscles over that 30-minute period than just trying to ski as warming up with that too. So what does this look like? Well, the newest issue of Outside Bozeman just dropped last week, their winter edition, and I wrote an article on a dynamic warm-up for skiing and snowboarding in that, and it goes through basically doing things that you want to go through a full range of motion where you think of the joints that you're going to use for skiing. So it includes, standing knee hugs and really trying to extend through the knee. Thanks. And things like leg swings that you see a lot of ski racers doing, and squats and rotation with your back as well. So either pick up the print edition. There's not a lot of print edition magazines, periodicals these days anymore, and I always like having something in my hands to page through, but online too, you can access the article, and there's pictures of me going through all of those as well. So again, a dynamic warm-up can be a great thing to do when you first get to the parking lot or while you're standing in line. Okay, and then lastly, for things to do on the hill is really looking at your technique and the amount of training that goes into it. So again, thinking especially with skiing that beginner level skiers have in some studies 2 times the injury rate of ACL tears than more advanced recreational skiers. Just overall, like improving your skill as a skier is big. And knowing what the proper ski form is to keep your weight forward, keep your hands down the fall line so you're not twisting, because again, that twisting is kind of one of the main mechanisms for how the ACL tears. And then if you are falling, thinking about things that you can try to do last minute to prevent that knee injury from occurring. So again, thinking that, realizing that one of the more common ways that you can tear your ACL is that backwards twisting fall. So really, if you are falling, try to get your hand back in front of you and get your hands over your skis is a big thing. Also trying to avoid sitting down and sitting back into a fall and not letting your hips get below the level of your knees. And then if you are down and you're sliding along the snow, it's much easier to try to catch your ski if you're trying to get back up before you stop moving. So, a common rule of thumb is if you're down, stay down, unless you're in imminent danger of getting a much more severe injury, like sliding off a cliff or sliding into a tree or a lift tower or something. But typically, again, if you're down, stay down until you stop moving and then get up. And that can be a great way to, again, try to mitigate the risk of injury. Same thing if you're going down, rather than trying to save the fall, often it's better to just go down all the way, rather, because again, those ACL injuries are occurring when people are trying to save the fall or get up after a fall too quickly. And then for snowboarding and freestyle skiing, a big thing is with your technique with landing. And if you're falling from a jump, learning how to fall. So I know some of the free ride team is here, getting good instruction from your coaches on how to fall and use momentum to keep going down the hill, because you really get injured when you stick the fall too much. And also thinking about, checking out the landing before you hit something, so you know what speed to hit it with, so you're not overshooting the landing or coming up short. And when you are landing, try to land where you have your weight underneath your feet and you're not too far in the back seat. Because again, that is one of the main reasons when landing incorrectly off of a jump, how someone gets injured. All right, I'm going to turn it back over to Kylie for the last bit here.
All right, so moving on to more prevention strategies, strength training and utilizing an exercise-based injury prevention program. Research has shown to be useful in just reducing your overall injury risk and ACL injury risk in alpine skiers. So what does that look like? Starting now, if you haven't already started, working in the preseason to get your legs super strong prior to the season starting is going to be super important. And then continuing into the season, your ski days are not your strength days. So making sure that you are supplementing those days on the ski hill with strength training outside in the gym at least 2 to 3 times a week. So again, what does that look like? Getting your legs super strong. Some areas that we really want you to focus on. Quad strength, like Jason was saying, those muscles on the front of your thigh are super crucial for general knee health, performance, and mitigating ACL injury risk. When we are in that knee bent position in skiing and in snowboarding, we're kind of locked in that position. We're stressing the quads out a lot. So making sure that you are training the quads in your training sessions to make sure that they can keep up with the forces of skiing and snowboarding when you're on the hill. Other muscle groups to focus on: hamstrings, glutes, and hips. A study by Hu et al. Showed that working eccentric hamstring strength at least a couple times a week. So what is eccentric hamstring strength? It's that lengthening position. So if you've done like a Nordic or like a tempo deadlift where you're going slow, quick up, activities where those hamstrings are lengthening, working those a couple times a week has been shown to be a really significant reducer in lower extremity injuries, just in sports in general. Moving on to the glutes and hips, skiing is and snowboarding, a very dynamic sport. So we want to make sure that we're strong, not only moving forward and back, but side to side. Hips and glutes really important in that area. Focusing like this lovely lady here on compound lifts can be a really useful way to get that lower extremity strength in. Utilizing barbell strength kind of as a tell of where your strength is at relative to your body weight can also be a good demonstrator of your ACL or just general injury risk to your knee. So for men, if you are able to, or if you're squatting less than 2.2 times your body weight, or for women squatting less than 1.6 times your body weight, that puts you at a higher risk for injury. So getting that 1 rep max back squat up is going to reduce your risk for knee injury. Again, thinking about compound lifts, deadlifts also super important. Jason and I were talking and thinking about like 4 exercises to focus on. We choose barbell back squat, barbell deadlift, single leg RDL, like with a kettlebell or dumbbell, and then something where you're moving laterally, like a lateral lunge, to make sure that you're getting that kind of change in direction strength. Secondly, moving on to core and postural stability strength. Like I was saying, we're kind of locked in that bent knee position, especially with skiing and snowboarding. But that kind of changes our lever arms, and you have to be able to use your core and that postural stability strength to keep up with the demands of skiing. All right, moving on to fuel. Fueling throughout the day is going to be the best way to make sure that you can keep up with your skiing throughout the day. Utilizing an increased caloric intake on big ski days to keep up with not only the demands of your body, but also just staying warm. Especially in Montana, it's cold. So your body is just working harder to keep you warm and to keep your muscles warm. So increasing calories on big ski days. And studies have shown that there's not many regenerative effects of taking like a longer lunch. So having snacks throughout the day. This is me skiing in Tahoe. I think the Uncrustable is the like best ski snack, but that's just me. We've got some fans in the back. Thank you. But just thinking about like small snacks you can stick in your pocket that are, I don't know how nutrient dense Uncrustable is, but you know, things that are easy to eat, nutrient dense, protein, carbs, stuff that you can snack on throughout the day versus waiting until noon, having, you know, chicken tenders in the lodge. You want to make sure you're fueling throughout the day. Hydration is another super important aspect of fueling. Dehydration in general, outside of sport, can lead to impaired cognitive function, performance, and aspects like depth perception, which is a really important aspect of skiing. If you're skiing on a powder day and you can't really see, you're already dehydrated, your depth perception is already going to be struggling. We just want to avoid those things. So having a water bottle in your pocket, taking breaks throughout the day to make sure you're hydrating is going to be again, important in just reducing overall injury risk and optimizing your performance. Lastly, sleep deficiency increases risk of traumatic sports injuries, making sure you're resting up, taking breaks as you need. I know a lot of people here like ACL tears or just injuries can happen at the end of the day when you're tired. I know that's how it happened for me last couple runs. If you're tired, just rest, take a break, call it a day. Avoid skiing on a super tired body. Doesn't always end well. All right, so moving on to how Excel can help. So we at Excel can help you just assess your overall injury risk and do different sorts of assessments to make sure that we are nipping things in the bud, taking care of small injuries, speeding up your recovery, assessing asymmetries left and right to just avoid any injuries at all. And of course, if worse comes to worse, we are here if you are going through operative or non-operative rehabilitation. ACL reconstruction is a very common surgery and is very successful. And also in the non-operative realm, studies have shown that mid-substance tears, so tearing in the middle of the ACL, is starting to show healing on its own. So if you do want to go the non-operative route, there is success in that aspect too. So again, what does it look like if you were to come see us and do an injury screen or a strength assessment? So as far as our strength testing goes, like I was talking about before, that 1 rep max deadlift and squat is going to be a really good tell kind of where your strength is at and how that shows injury risk in general. Other studies have shown utilizing tests like the 60-second squat test, how many squats you can do in 60 seconds, whether it's double leg or single leg, utilizing various like single leg depth squats, how many squats you can do on 1 leg in 2 minutes. That one stinks, but it is a really good show of just strength left and right. And especially with the strength testing, hop testing, and agility and stability, we're really looking for those asymmetries left and right. Like Jason was saying, I'm going through my rehab. I'm about 7 months out now. I'm always looking to see, okay, my non-operative side, I can do a pistol squat all the way down. My operative side, I'm still struggling with that single leg squat. I'm not ready to ski yet. So just an example. Moving on to hop testing, single leg hop, double leg hop, lateral hopping, things like the hexagon test, where we've got a taped hexagon on the floor, testing how quickly you are able to jump in and out of that hexagon. General just ability to, or general agility and hopping. Whether you're jumping when you're skiing or snowboarding or not, it's still, you may be jumping not purposefully. Can you land from that jump and have the stability to maintain and stay on your feet? Lastly, agility and stability testing. Y-balance testing is a really good test of just single leg stability, focusing on that 1 leg stability, like I said. And then lastly, just general balance assessment. So in summation, ACL injury incidence is super high in skiing and snowboarding. Important to prevent, important to be educated. So we appreciate you all coming out here tonight. It's just better to know these things so that you can avoid injury. Tell your friends, help them avoid injury. Check your equipment, making sure that you're going into your local ski shop, getting your bindings checked every year. Warming up and fueling up, using the dynamic warm-up that Jason was talking about, making sure you're fueling throughout the day. If you're down, stay down. Don't try to get up if you fall. It likely will be better if you just let it happen. Stay down. Get strong, utilizing an exercise-based injury prevention program, focusing on that lower extremity strength for general postural stability, help prevent ACL injury. And lastly, we are here to help. Come and see us. We want to help you. And yeah. Cool.
Yeah, here's our contact information. If you have any questions that don't get answered tonight, we're happy to have you reach out. And then also, this is a free event. Truly is a free event, but you know, we do really like to support the community and support good nonprofits within the community. And if you're unaware of the Bridger Bowl Foundation, so it's different than the Bridger Ski Foundation. It's the Bridger Bowl Foundation. It's a nonprofit to help get more kids out on the hill. So they raise money to provide for middle and high school kids to get to Bridger Bowl and take lessons and things, and not, you know, especially if they don't have the means to get them out on the hill. So, you know, in lieu of us charging anything, if you would consider a donation to them, that would be great. So we have the QR code here, as well as there's a QR code on your way in. But we'd be happy to answer any questions right now. And again, thanks for coming. So any questions? I'm sorry, could you repeat the question about knee valgus? Yeah, so there is a theory out there that knee valgus, so the position I talked about with that knee caving in and how the ACL injuries are occurring, there's a theory out there that, well, if that's where the knee injuries are occurring, why don't we train people to like be in that position to build more strength and control in that position? None of that's been tested. And all the research looking at ACL injuries, not just in skiing and snowboarding, but in non-contact sports like soccer as well, is it's very universal that that valgus position is key. And what I notice as a clinician is when people are weak and they don't have very good balance, they tend to dive into that valgus position. And so from experience, like really working with people to control out to get out of that position seems to be really helpful. But great question. Yeah.
Yeah, at what age would you say is appropriate for a competitive ski athlete to really focus on building those protective muscles? And is there an age that you guys tend to see those ACL injuries start?
Yeah, great question. So the question is, at what age is it appropriate for someone to start strength training, especially if they're a competitive skier? And then secondarily, at what age do we see, people starting to come in with ACL injuries? So for the first part of your question, what age is it appropriate for them to start training with strength training? Really any age, especially with body weight type stuff. But then as you're adding load, you really want to be cognizant of that, they're able to maintain good form with that. And, that they are going through some skeletal maturity with that. So I'd say once the skier is hitting puberty, that's probably the appropriate age to start adding more load to their strength program. But you do need to be really cognizant of having some good supervision to make sure that they're going through the right ranges of motion, as well as that they're telling you like if things are hurting or not with that. And then as far as like at what age are we seeing, ACL injuries coming in? I've had as young as 11 years old, which growth plates are still open, so it makes it a little bit of a different surgical consideration. But I'd say the vast majority of people, and we're biased with having MSU here too, is like your late teens, early 20s is probably like the highest age group that we see here.
Part of why I asked that first question is, especially in slopestyle skiing, we're just seeing the progression and the age that these kids are competing at a high level is getting lower and lower and lower. So when I was in sport, it was like 18, you were in your prime, and now it's like 16.
Yeah.
And so there's kids as young as 13, 14 years old that are on track to be doing World Cup events. And so I just didn't know if depending on the ability of the athlete, if they're coming down, hitting 75-foot jumps, they should be really trying to target, accelerate a little bit the lower leg protective ACL muscles, or just rely on their athletic.
No, I mean, I think definitely like from trying to like preventative, as well as like they're going to perform better too, if they can build some strength. And, I think a big piece of it too is how motivated are they? Because, with some of the younger age population, like it's not fun for a lot of people to be in the gym, but if they're really, focused on their performance in that sport, it's an important piece to add in, and just ramping them up slowly with load to make sure that form should always be key for that when you're in the gym, is making sure that they're not, their back isn't like collapsing in over the weight, and like changing things up to where they're holding the weight so they can maintain good form with targeting the leg muscles. Yeah. Go ahead.
For riders, is there any correlation between the stance angle and the injury that
Yeah, so that's a great question on if there's any injury or any correlation between the stance angle of the front, or really the bindings on the snowboard. So, is someone duck foot where they have positive on the front, negative on the back, or, what degree of positive angle do they have on the stance? And unfortunately, there just aren't the studies out there. And we see so many more ACL injuries as a whole and with skiers that anecdotally, with having people come in here, like snowboarders coming in with ACL tears and rehabbing them, I haven't noticed any trends with that either. But great question. Yeah. In snowboarding? So in snowboarding, the number one knee injury in snowboarding is an ACL tear. So, and then as far as like the other ligaments that can get injured in snowboarding with the MCL versus LCL or PCL, you can have posterior lateral corner. I mean, the knee's pretty complex. There really isn't too much data out there, but with looking at ACL, so it's very rare to have an ACL tear in isolation. So generally, especially in skiing and freestyle, or in snowboarding and in freestyle skiing, because of the higher degree of impact, because the injury is typically occurring with landing off of a jump, you're going to have multiple structures injured within the knee. With the ACL again being the most common, probably followed in snowboarding by more of a meniscus, injury to the meniscus. And in skiing, it could be meniscus or MCL with that. Yeah. Go ahead.
So curious, you mentioned that not going to put the suggested 2 times in the gym, lifting, doing squats, that was lower body, but would you suggest just one single heavy day and the rest of the body, or you suggest lots of singles?
Yeah, that's a great question. I think it depends on your goals. I mean, you definitely want to have heavy days to just build that pure strength, but also balancing that with some lighter days, some more dynamic stuff like we talked about, like single leg RDL. Like personally in my rehab, I'm doing like heavy single leg RDLs and then lightening it up, doing some more like dynamic movements. So I'm working on balance and stability in general. So I think having a good balance of that, making sure you're hitting those pure heavy strength days, but then changing that up with the other couple of days and still hitting those muscle groups, but with some kind of different exercises, different loads, if that makes sense. Yeah, it's a lot. It's a lot of volume. And especially if you're skiing a lot, it can be hard to fit in. And that's just kind of maybe where your schedule lies of just trying to fit it in. But definitely, I would say in season, focusing on lower body more. So if you do time-wise have to drop off, I would say upper body is the first to go. Yeah.
There is some research to support, especially when you're in season and your volume of training, with a lot of cases, just with recreational skiing or snowboarding, that can be your training volume. When that's high, you do want to decrease your days in the gym. And as little as 1 day in the gym, as long as you're training or lifting at a high enough intensity rate, is enough to maintain the gains that you hopefully made in the preseason. So, ideally we'd be having this talk in October, but none of you would show up because it's still have mountain biking on the mind. But it's still not too late to really start getting into a strength training routine and see some gains for this upcoming season, as well as decrease your injury risk. But really to promote strength, you want to have those heavy days. So minimum of 2 days, heavy days a week while you're trying to build strength. 1 day a week, the same intensity to maintain.
Yeah, good question.
About the wide balance test, is that what you put on Instagram post?
Yes. Yeah.
What's the metric that is assessment? for, potential for next week?
Totally, yeah. So the metric is like how far, so the Y balance test, if you guys aren't familiar, so there's a taped Y on the floor. You're standing in the middle of it. So I'm testing my left leg right now, and I'm reaching back as far as I can, tapping on that piece of tape and measuring how far exactly I can touch. And then I'm doing it, it's gonna be worse on my surgical side, but reaching as far as I can. If I'm not able to be symmetrical side to side, that shows I need more work on my right side. And as far as training, that's a fantastic, even just exercise assessment tool, yes, but using those kinds of things as an exercise, fantastic too.
A lot of times the test becomes the
Yeah.
training and then the training. becomes the test.
Yeah.
Yeah, when an injury occurs, is there always a sound, is there always something that's not about, or have the injury and it, you know, in the moment?
Great question. So the
Mhm.
question is, when an injury does occur, are there certain signs or symptoms to know like, oh, did I tear my ACL or did I not? It's never always, but a lot of times people will report the feeling of a pop in their knee, and then the feeling of like, immediate pain with that. And then shortly thereafter, their knee is really going to swell up. Okay, so, a big knee effusion or swelling of the knee, the most common way that occurs is from an ACL tear. But it doesn't always happen that way. That didn't happen when I tore mine. I just knew like I really hurt my knee. But I actually continued to ride like the whole rest of the year with it subluxing on me every once in a while. And finally my wife made me go to the doctor and sit you and ski with me anymore. But I didn't have much swelling after mine occurred either. But the vast majority, you're going to have a lot. If you get an injury and you have an effusion or swelling in your knee, that's something to go get checked out. And if you furthermore had during that injury, it felt like you had a pop, and then when you're walking on your leg, it feels unstable, that's more of an indicator. But unfortunately, not everything's more gray than truly black. Great question.
Follow up on that, would you like when you're able to see?
So you can partially. Yep. So Kylie had mentioned kind of at the tail end there of like what we can do to help with like rehab. So yes, you can have a partial tear of the ACL, but you can also rehab a full tear non-operatively and return to sport. It's a pretty small percentage of people who are able to do that. But in Europe, for example, that's kind of the way they approach things first. Is first and foremost, you go to rehab and see how well you can do. And then if you're still having issues, then you get them. That's not really how it works in the US. Usually you have an injury, go right to surgery. It's not really an option. And like typically it's like, you look at the studies, anywhere from 15% of people to 20% of people are what we would term copers. So they have a full ACL tear, but they're able to return to the same level of dynamic sport that they were prior to injury and do just fine. And I'll say like anecdotally, like throughout my career, and you can tell by my hair, I've been in it for a while. Every year of my career, I've had at least one person want to try non-op. For some reason, 2 seasons ago, I had like 10. And prior to that season, I would say that the people who were trying non-op, in my small window of seeing them, for anywhere between 6 weeks and 6 months, 50% of them were able to return to sport successfully. Now, I don't know if they ended up going back and getting surgery because after that season and then not coming and seeing me for the rehab or not following up. But then that year I had 10, I had like 70% of them got back. And like some of them I know are still like, I see them out all the time. They're still doing really well. So that's really cool. And then even more cool is that Kylie had mentioned that there's some more recent studies showing that the ACL can heal spontaneously. It's probably very rare instances, but that is out there where it can heal on its own. And maybe those are the people who are actually able to get back to sport.
I was curious, you're actively rehabbing relatively fresh.
Yes.
ACL tear. For an older injury, do you have any recommendations on the pros and cons of like utilizing a brace as like a complement?
Are you talking about like any injury or just like
For
for skiing? And like if like you have an ACL tear or just a
or like an old sort of sad knee.
sad
or
knee?
something.
Yeah. So the question is like utilizing like a sport brace or a knee brace for while you're skiing or snowboarding, and probably I think what you're getting to like to decrease your risk of injury. There's very little to support that in the literature. However, there is one study out of Vail showing that bracing does help, but there was no difference between using a neoprene brace and a really expensive carbon fiber. So I think my takeaway from that study is having the brace on it just kind of reminds you that your knees feeling funky, maybe even subconsciously. And so maybe it increases your reaction time just a little bit. And really using a neoprene brace versus like the sport brace that costs like at least several $100. At least looking at the evidence, there's no difference.
Yeah.
I will say that after surgery, with people returning to sport, most physicians will have their patients wear a brace, not all. And then I've had the opportunity to work with US Ski and Snowboard, and their policy is the athlete wears the brace for the first season, and then it's up to them after that. And I think that's a really good policy. So you have that on there as a reminder. It does restrict your motion a little bit too. So you have that with it too. Most people hate them because they're not that comfortable, makes your leg heavier. So I think the majority of people, after they get their legs underneath them with one season, end up ditching the brace. But there's really no downside.
Just a quick follow-up, this Cal question of not getting reconstruction surgery and just strengthening. Is there any studies that show later on in life that then comes back onto
Yeah.
you?
Great question. So the question is, let's say you decide not to get your ACL reconstructed and go the non-operative route. Does that set you up for an increased risk of further injury to your knee, or further disability? So the big one is osteoarthritis for the knee, and there's no difference. Okay. Unfortunately, once you've had the injury to your knee, you're at a 4 to 6 time increased risk for developing arthritis. If you have surgery on top of that, that further increases the risk by 3 to 4. So you're already at an increased risk for arthritis. Knock on wood, mine is over 20 years old and I've not developed arthritis in my knee. So as far as that, there's no difference. If you look at some other studies at injuring other structures within the knee, there is a slightly elevated risk of tearing your meniscus with not having it. However, that study showed that there was no difference in terms of, again, the incidence of arthritis later on, as well as people like staying within their sport. So I think it's really important to realize that, yeah, you've lost a structure in your knee, and if it did not spontaneously heal, that could set you up for further injury to that knee. But at the same time, if you have surgery, that elevates your risk for arthritis too. So being really well informed and going into it knowing the risks is in terms of if you're going to pursue non-operative care is
It's interesting, but I've had 3 major knee surgeries. I've had 5 total, but 3 major, 2 of them were at Stead. And it was always, and I heard the buddies who were there, that was, well, you're young, so let's get it repaired. But if it's showing that it's, even that much more likely to show, I mean, I feel like I already have arthritis. But if it's something that seems like it increases that much, and there's not, you know, that huge of a benefit to go non-operative to operative, I wonder if that started to shift at all, within.
I think it's very slowly starting to shift, especially with those papers that came out last year showing that the ACL can't heal. I'd say my own bias, like I'm still pretty tentative if it's someone who's in high school to say, hey, let's do this non-operatively. Just because of their age and their activity level, they're just at an increased risk anyways for injury. Whereas if someone's in their 30s or 40s, I think absolutely they should try it. I know if it happened to me again, it's certain. Any other questions? All right, cool. I also coach for NICA, and one of the things with working with middle and high school kids is you wait 7 seconds. If there's no one saying anything, it's time to be done. We're gonna be done. Thank you everyone for showing up. We did record this and we'll be sending it out in our newsletter likely in January. So if you know of anyone who you think would benefit from hearing this or is interested in this, just have them contact our office and say they want to get on the newsletter to get the talk. But again, thank you for coming out. I hope everyone has a great ski and snowboard season, and you all stay out of here and just come here for like these type of events and don't actually come see us as patients. And if you are so inclined, please consider making a donation to the Bridger Bowl Foundation. Help them raise money to get more kids out on the lawn, especially those kids that can't afford to be there. Thank you.
Thanks.